Good morning, good afternoon, and good evening to all of you, wherever you're joining us from. And welcome to this regional workshop for Latin America, which is focused on school health and NCDs. And today we'll be particularly concerned with management and control of NCDs and school health.
Edilene. Thank you very much, Beatriz, and good afternoon, everybody. First of all, I'd like to thank you for having invited me and for the honor to be able to introduce to you Professor Didier Jourdan, who is in charge of the chair of UNESCO. The interpreter apologizes. Madame Edilene is muted. Hello?
Yes.
Yes. Can you hear me? Yes. Okay, I'm going to introduce to you Professor Didier Jourdan, who, as I was saying, is the UNESCO chair in global health and education, and he heads the WHO Collaborating Center for Research in Education and Health. He is also the Dean of the Faculty of Education at the University Blaise Pascal in France. And he is also director of the promotion of health in public health in France. He's a very big specialist in public health. Please, Professor Didier.
Thank you so much, Edilene. Thanks a lot to all of you. Thanks to give me the opportunity to share the vision of the UNESCO chair and WHO Collaborating Center in global health and education. We're going to talk for the next 20 minutes about the question of the strategies for management of NCDs and educational continuity for children with a chronic condition during the COVID-19 pandemic. I just would like to share with you 5 ideas during this 20 minutes. The first of one is the question of the framework for the return to school for children and young people with NCDs. The second is to learn from the field. What do we know? Of course, we are far from the perfect world. A lot remains to be done in schools. So we need to learn from the field. Then we will go back to the school perspective on the question of students with NCDs. And then the second part of my talk will be focused on the levers to change, how to move forward. And I will conclude with the specific role of the healthcare professional. So concerning the framework for the return to school for children and young people with NCDs, first of all, I would like to say that this webinar is timely because, you know, researchers and a lot of people are more and more aware that we are not facing a pandemic, but a syndemic. It's not only the question of fighting about the virus. It's a very complicated interaction of intertwined different factors that are linked, of course, to the epidemic itself, but also to the social factors and to the NCDs. You know, it's not only talking about comorbidities, it's talking about interaction between an infectious disease, NCDs, and social factors. And then it adds to help us to think health differently. We have to change from a paradigm to another. So if I'm back to basic, of course, all of you here already know that children with chronic illness have to be in schools. They have the same needs as other children. You know that living with asthma, type 1 diabetes, juvenile arthritis, mental health issues does not make you a different person. You cannot limit children with NCDs to their NCDs. They are children, they are young people that need socialization, they need learning, they need to live in a positive environment, an environment which has a positive impact on their development, which is most of the schools, the link with the peers, the link with the adults. And I'm sure that we share that denying school to those who need it most to succeed, and especially young people with NCDs, is just a social disaster. So clearly, we have to organize everything for these kids to be in school. But of course, we need a framework because it's not evident. And in the work we did with Nicola Gray and Janet McDonough, we identified 3 kinds of situation talking about the management of the situation. The first one is, of course, we have children and young people at very serious risk because of issues linked to the immune system or to lung disease, and these kids have to be shielded. And we now have more and more tools for blended learning, for telemedicine, but of course it's not a panacea. But this is something we can use to maintain the links and to also use that with all the kinds of homeschooling, for example. But these are a very limited number of children living with chronic condition. Most of them, and this is the second category, have well-controlled syndromes, and then they will benefit to stay in schools. And unfortunately, we observe that in many countries, people are afraid with that, and they are refusing children and young people with NCDs to come back to schools. And of course, there's no reasons for that. And of course, there's a third category, especially with young people and some adolescents whom their symptoms are not really controlled. And for them, there is a need for the adjustment of the care plan. But knowing that, we cannot consider that by definition, all the kids with chronic conditions are vulnerable, that have to be hidden in their rooms at home. We need to have a more in-depth analysis of their situation. Of course, you can say that's a good idea, but now the point is, if we want to have the kids in school, and if we want to make school just like Beatrix, just say spaces for health promotion, how could we do that? So now I would like to come back to the real world, because you all know that if we just have to publish guidelines and that by definition they will be implemented in the field, we would know that. You know, it exists. It exists in the world of the care bears, where everything love each other, where life is so good and everything is pink. But sorry to say, we are not living in this world. This is just a dream. In our world, the question of inclusion of students with NCDs, the question of the COVID-19 are not top priorities. First of all, because we have other medical priorities, such as other kind of infectious diseases, such as issues linked to parasites, to malaria, to worms, that are clearly important. You know, some countries just didn't close the school and do not develop any framework because they have so much other kind of priority issues. The second reason is that we also have a lot of issues in relationship to health with the school facilities. Think at ventilation. If you cannot open the windows of the room because you have mosquitoes entering, how could you ventilate it enough to limit the propagation of the virus? And it's the same for the access to clean water to wash the hand. So we have many other issues. And as you know, in many countries in Latin America, and this is the case everywhere, we miss school nurses, we miss school doctors. So these two things together means that we cannot consider that one size fits all. We are in a situation where, depending on the countries, depending on the situation, the regions, we will have different ways to manage NCDs during the COVID-19. We did a survey within the community of the UNESCO chair in 42 countries. And I just would like to share you few ideas on what we learned from the people in the field. When we talk about this question of the guidelines and the management of the COVID-19 crisis in schools, what we observe in at the global level is that most of the guidance is only limited to hygiene measures, nothing about education. And when we ask the people in the field, they are in trouble Because schools, it's not only managing the distance, it's also teaching, it's also educating the students. First thing we learn from the field. The second is that when you don't have a good cooperation between the stakeholders, it is extremely difficult to reopen the schools in good conditions, and especially to have the children with NCDs. First, and it was an incredible surprise. Perhaps you won't be surprised, but we were. None, very few in fact, none of the responders in the data we gathered never ever mentioned the local health providers. Nobody never talk about the GPs, the nurses, the pharmacists. Do you realize that we are living on a planet where you have a big health issue in schools, but the cooperation with the health professional at the local level is extremely limited, at least in our survey. Perhaps we missed things, but this is an issue. This is something we have to think of. The fourth idea we learn is the question of inequalities. All the people said that it increases the inequalities, and they were very worried about that. Of course, depending on the country, the resources are, of course, missing. In many, many countries, people do not have masks or enough soap for the children. So what is extremely important at this stage is to realize that we are living in different conditions, but what is clearly missing is the cooperation between the different actors around the students. Of course, you also know that there's a lot of different experience. People living the crisis, and especially the students with NCDs, their parents and the teachers who have to have them in schools are very often in difficulties, increasing the stress level, trying to find new practices, a lot to do in that field. My third idea is then to back to basics. We have in mind that the priority is to have children and young people with NCDs in schools. We see that it's pretty difficult. One of the reasons, and again, this is what Beatrix said in the summary of yesterday's talks, is that we have to think not only through the glasses, I would say, of the family, of the children and young people, of the medical doctors, of the state, but we have to use the glasses of school, the glasses of school systems, if we want to be able to manage in a good way this question of the children and young people with chronic conditions in school. We need to think of what it means for school using the language of a school. So from the educational point of view, the first thing linked to chronic condition is that it is a major form of discrimination. So for schools, it's a question of inclusion. But it's not only that, it's also a question of teaching and learning, because schools have the responsibilities to enable all students, including those with NCDs, to develop skills for self-fulfillment as individuals, but also to live in communities. And finally, education in the field of health, living with people having a chronic condition. And for these people, health literacy is absolutely critical. So we have to have in mind that thinking through the lens of the school systems is thinking of inclusion, equity, and citizenship. So it's not only protection, it's protection together with education. It's not only, and in every country you have healthcare plans, this is the French version, but you have that in many countries, that organize the everyday life. But we also need to create the condition for an efficient education and to give the means to all children and young people with NCDs to succeed. It's a question of equity. So how to do that? What kind of lever do we have in our hands to contribute to a positive change in this context of the COVID-19 crisis for children and young people with chronic diseases? First of all, we have to forget that we could find a magic wand. There's no magic wand. We have to think at all the determinants of the school policies and practices in a way which is not implementing a policy, but an improvement. You know that what happens in Caracas and in the rural regions of Bolivia is totally different. So we cannot imagine implementing something in these two countries, but we could try to improve in every school the way in which we are schooling children with NCDs. To do that, we have to think clearly of what's important if we want to introduce change in the school systems. There are 4 different levers. One is the policies. We need policies that encourage inclusion of children with NCDs, but it's not enough. We also need structures and systems. It means the organization, the facilities to make it possible, but it's not enough. You need to have relevant practices. We have to talk of health promoting practices. The practices of headmasters, teachers, and all the people involved have to be health promoting for children with chronic diseases that help them to live with their condition and to be free in a vision of emancipation from this condition. Again, a chronic condition does not define the young people. Young people are people in development, and the chronic condition is only one of the determinants of their future life. And then, of course, we have to think of the human resources. Without relevant training, without relevant recruitment, it's going to be difficult. So if you come back to the data, the evidence-based data, moving forward in terms of schooling of children and young people with chronic diseases, have to let us to think simultaneously on policies, structures, and system practices and human resources. And if I summarize what we need to do is, first of all, as I already said, to promote intersectoral approach, because there's always social dimensions and health dimensions embedded with the educational dimension for children and young people with chronic diseases. It's also, of course, the genuine involvement of the young people. Young people are able, they are the best specialists of their own diseases. And we need to change the vision we have. Intersectoral approach, genuine involvement. But to do that, we need to have extremely strong advocacy strategies. You know, if it's only trying to change things at the local level, it's important, but we also need to contribute to social change at a global level. And this is one of the missions, of course, of NCD Child. And finally, of course, the key question of the development of the capacities of the education professional is absolutely critical. Yes, and this is why I use this photo. We have to build bridges between the people, between the young people and the professionals, between healthcare professionals, social professionals, and education professionals. And of course, it has to be very concrete. You have here a table, you will have the presentation if you want, but just to say, if you think of diabetes, having kids in schools, for example, in primary school with type 1 diabetes, need to have policies for these people having this long-term condition, but also on urgent care, depending on what happened with, if they are in hypoglycemia and all that stuff. The second is to have structures and clean spaces and places where they can receive the medicines and the treatments they need, and also the communication, the explanation. You know, the experience of children with young people in schools is very often linked to people do not understand what's my life and what I need, and they talk about their peers, but also the professionals. This is part of the organization of the schools. This is also, of course, human resources and diabetes awareness among the professionals, and then the practices that have to be concrete, not only, again, hygienic and medical practices, but also educational practices. I would like just now to be more concrete and focus on teachers. Why teachers? Because you know this is the majority of the education professionals. Of course, we have other professionals, especially masters, health professional, social professional in schools, but how could we move forward with the teachers in the different countries in South America? First of all, I don't think we have to, be in a kind of a moral posture explaining you have to do that, just because it's extremely difficult to take together all the tension and the pressures of the teaching activity at the time. But what research told us is that if you want to understand what could lead an education professional to be able to, contribute to inclusion and equity for children and young people with NCDs, we have to know that it's not only a question of guidelines and circulars and laws and institutional factors. All the surveys demonstrate that it's mostly linked to personal factor. The vision they have of their role, a question of vision of their professional identity. Why am I paid for? This is also linked to the students themselves and the knowing they have and the context. But it's not only that. Research shows that what drives the professional activity of the teachers is also their impact on students. There's also the impact on themselves. You know, it's hard to survive, I would say, every day and in an entire career if you are a teacher. You need to have rewards. And we have to shape inclusion as something that is rewarding for the teachers. And of course, the parents, the community, don't forget that, of course, an important part of the parents are not in favor of the inclusion. If we want to move forward, we have to forget that guidelines are enough. It's more personal factors and factors linked to the community. And you know, research shows that for teachers, the institutional determinant has a very limited impact on the practices. It's more the personal determinant and the student-related determinants, the relationship with the family. Of course, it's totally different for nurses and doctors. For whom the institutional determinant is prominent. So just to conclude this part, we really need to have in mind that moving forward in the field of inclusion and equity for children and young people with chronic diseases, we need to do that with the teachers and contribute to a renewal of the professional identity. And this is capacity building, this is working condition and remuneration. But I would like to say that for me, capacity building is the priority and the role of healthcare professional is absolutely decisive. Of course, we need not only to say, you have to do more, because all the teachers on the planet have a very heavy workload on their shoulders. What we have to do is to contribute to reorient their professional identity in order to make things coherent and not only a kind of accumulation of layers. I would like just now to conclude with a focus on the healthcare professionals and their role in schools. You know, it's not so easy. Well, imagine you're a GP, imagine you're a pharmacist. What could be your role? In some cases, the idea is that I'm a healthcare professional. I'm going to explain the teachers and the headmaster what they have to do with this kid with type 1 diabetes or juvenile arthritis. It doesn't work, of course, because it's a question of educational professionality. It's not a question of medical approach. And you know, when we work with the professionals, we always have to say, okay, take a seat. We are talking about children and young people that sometimes are your patients, but sometimes they are students. Children and young people, patients, students. How could we create coherence? It's not by saying, we're going to show you. It's not only by being too humble and say, oh my God, we are just a drop. We have no impact. No, not at all. The role of the healthcare professionals is absolutely critical from my point of view in all the different countries. This is to be catalysts of change. What does it mean being catalyst of change? It is showing that our professionals, healthcare professionals, are valuing what happens in schools and are making clear that schools are absolutely critical for the health of people. Don't forget the population trust in healthcare professionals when it's a question of health, and their role and the contribution to value and to show the importance of what happens in schools is really important. Of course, first of all, to support the schools in the inclusion of children and young people, and especially during the COVID-19 crisis. This is also contributing to the recognition of the school contribution to health. And this is during consultation in the pharmacy and everywhere, just to include questions with parents and with the children, with young people. What happened in schools? How does it work? What did you learn? In order really to change the views of the school. Of course, it's not easy. This is also to reframe the interventions. Very often, this is more kind of lectures. How could we move it to something like capacity building for the school staff? Because if you want to educate, it's better to have educators. If you want to cure somebody, it's better to have healthcare professionals. All that things are linked, but we have the priority is probably to strengthen and to give more legitimacy to the education professionals by capacity building, building their motivation, contributing to, for example, the implementation in schools of the COVID-19 measures. Thank you so much. I just shared the ideas of the UNESCO Chair and WHO Collaborating Center, a framework on the return of the children with NCDs in schools, what we know from the field, the importance of using the glasses of schools, the levers for change, intersectorality, participation, capacity building, and the key role as a catalyst of change of the healthcare professionals. Thank you so much for listening.